Economics Final Exam Project by Alexis Koenig, Brooklyn Roback, and Maddie and Kamichia. First, let's talk about capitalism or socialism. Our lives have changed significantly during the coronavirus pandemic. The closing of businesses, the loss of jobs, and no social interaction. All these things have affected every single person around the world. Since the coronavirus, the United States has turned into a more socialist command economy because the government is answering the three questions: what, how, and for whom to produce. The U.S. Congress has passed a massive stimulus bill that provides for hundreds of billions in new spending, expanding unemployment insurance, and providing a cash handout to low and middle income Americans, which should help laid-off workers make ends meet until the economy begins to recover. This reflects characteristics of socialism because the citizens are relying on the government to provide money for them. House Democrats introduced the Take Responsibility for Workers and Families Act, a Phase 3 coronavirus response bill that injects more than $2.5 billion into the American economy. This also reflects characteristics of socialism because the citizens are once again relying on the government to provide money for them. Every bill consists of the government funding or providing the people money, which is a characteristic of socialism because the government has more control. The people who are protesting are most likely people who have lost their jobs or are over the lockdowns that have been extended way more than once. This has to do because they want our economy to go back to the mixed market economy that it once was. They want the people to decide the three questions instead of the government. Next, we're going to talk about supply and demand and how they are both affected by the coronavirus. First, let's talk about demand. At the start of the coronavirus, toilet paper was in very high demand, which caused a shortage of it for months after people stopped buying it in the bulk. This made the demand curve increase, no matter if the price increased, because people were afraid of the future and that toilet paper is an essential item to them. Since the lockdowns of states, there has been a surplus of milk. This is because the milk makers would supply restaurants and schools, and since they're closed, the amount of milk was not being adjusted, and they had to dump out milk because they had way too much. This causes the demand curve to shift as a decrease in demand. You can tell that there is a decrease in demand when looking at the top right graph. You follow the pink arrows, and you can see that there has been a decrease. Now let's talk about the supply and how that's been affected by the coronavirus. So since the lockdowns around the world, there's been a decrease in the cars made and bought during these last few months. Since people cannot leave their houses, they have no need for a car, other than go into the grocery store. Therefore, there's been a decrease in supply of cars, which causes a surplus of cars. This will cause the supply curve to shift to the left. If you look in the graph in the top right-hand corner, you follow the black arrows and you can see that there has been an increase, which is a shift to the left, and there will be a surplus of cars. Next, we're going to talk about the GDP and fiscal policy. The GDP has been impacted negatively as a result of COVID-19 in the United States. Consumption makes up 70% of America's gross domestic product, or GDP, but consumption has slumped as businesses close and as households hold off on major purchases as they worry about their finances and their jobs. Investment makes up 20% of GDP, but businesses are putting off investment as they wait for clarity on the full cost of COVID-19. Arts, entertainment, recreation, and restaurants constitute 4.2% of GDP. With restaurants and movie theaters closed, this figure will now be closer to zero until the quarantines are lifted. Manufacturing makes up 11% of U.S. GDP, but much of this will be disrupted too, because the global supply chains have been obstructed by factory closures and because companies are shutting down factories in anticipation of reduced demand. Ford and GM, for example, have announced temporary closures of car factories. 3.28 million Americans applied for unemployment benefits, the highest number ever recorded. Unemployment is shooting up far faster than it did in the 2008 recession, a sign the economy is headed toward recession. Continuing on, Families First Coronavirus Response Act. This provides free COVID-19 testing. Private insurance companies and government programs like Medicaid, Medicare, TRICARE are now required to cover testing of COVID-19 with no cost and no cost sharing, and reimburse labs for testing of the uninsured. Implements emergency paid sick leave. Employers having less than 500 employees are now required to provide up to 80 hours of paid sick leave at the employee's regular pay for quarantine, treatment, or care of a family member related to the coronavirus. Provides for emergency family and medical leave expansion. This legislation ensures 12 weeks of protected job leave for workers to care for a child whose school or child care facility is closed as a result of the coronavirus. Provides additional resources for unemployment insurance. An additional $1 billion in 2020 for emergency administration grants will be available to states for activities released to processing and paying unemployment insurance benefits. Coronavirus Preparedness and Response Supplement Appropriations Act. This is an emergency spending bill that was signed into law March 6th. It allocates $8.3 billion for help to fund vaccine development, treatment, and public health efforts. These are demand-side policies, as we need essential goods. Thank you for listening to our opinion on how the coronavirus has significantly affected our everyday lives, whether that be with our socialism, our supply and demand, or through the GDP and fiscal policy. Have a great day and stay safe and healthy.